The dramatic uptick in flu cases as millions around the country get ready to spend the holidays together. Medical correspondent Dr. Darien Sutton is here to talk about it with us. Thank you for being here, Dr. Sutton. We're hearing about this uptick in flu cases nationwide. So many people are going to be getting together for the holidays. What's the latest?
Well, the latest is that the flu numbers are rising. And I can say this personally from working in the emergency room this week. Many patients coming in with flu-like symptoms, body aches, fevers. But we're not just treating the flu, we're treating the complications of the flu. And we're seeing rates rise not just here in New York, but across the country, states like Connecticut, New Jersey. Right now, we're at 49,000 hospitalizations. Now, that's relatively low when you look at the overall numbers that we've seen in prior seasons. It can go up to 500, 600,000. But important note, the rate of change is significant. 4 weeks ago, that number was 6 times lower. So it's gotten six-fold increase since 4 weeks ago. As you can see on November 21st, 7,400 hospitalizations. So important to pay attention to. The majority of the samples tested is this new variant, subclad K, which is seemingly proving to be very infectious and traveling fast.
Okay, so if you get the flu or you're exposed to someone who tests positive, what's the guidance for taking medications like Tamiflu? Because you have to get it pretty soon, right?
You do. Within 2 days of symptom onset is when Tamiflu is most effective. And many might not know, but there are actually 4 FDA-approved medications to treat the flu. Tamiflu is most commonly used because there are generic options available, but the other options, Xofluza, Relenza, they're taken in different ways. Xofluza, for example, is a pill. Relenza is a mist that you can do. For example, these are options for those who are higher risk, diabetes, high blood pressure, because you have to balance the benefit, and the risk. They can sometimes come with symptoms of abdominal pain, nausea, vomiting, so you have to make sure that you understand that.
So real quick, on the topic of antivirals, if someone in your house has the flu, is that worth considering?
Yeah, so you're asking whether or not you can use these medications as prophylaxis. That means after you're exposed, yes, you can use them if you're using them early to reduce your risk of infection. And we maintain that mainly for those who are high risk. But Janae, to reduce your risk the most, we understand that vaccines help to do that for reducing hospitalization, ICU admission, and death. And right now, with declining vaccine rates, it's a part of the reason why this rate in the number of flu cases is rising so quickly.
And what's like 1 or 2 symptoms to look out for to know when to seek hospitalization or go to hospital?
Difficulty breathing, extreme pain. If you feel like your symptoms cannot be treated from the comfort of your own couch in your home, that's when you want to see a doctor. For most, if it's mild, you can check with an urgent care. But if you're feeling like your symptoms are significant, that's what we're here for in the emergency room.
All right, great. Important information, alarming numbers, too.
Yeah.
Dr. Darien, we appreciate it.